Our occupational therapy program, initiated in 1999, was the year that we offered the very first Doctor of Occupational Therapy degree program in the United States. We feel quite strongly that this degree provides the additional leadership as well as clinical training that are going to be necessary as students go forward in the care of patients who require rehabilitation therapy.
What do we call that if you have a lesion or a tear of that? What makes our program unique is really we have a strong clinical focus. We've pulled out some tracks that we focus on. The neuro track, the musculoskeletal track. We have the community portion of the program as well, mental health, pediatrics, and we have really strong faculty.
Creighton is unique because we are constantly evaluating and assessing ourselves, trying to make sure that we are on that cutting edge when it comes to occupational therapy education.
It's not just a program, it's so much more than that. The education, the expertise level that you have teaching you, years of experience, the research that these professors have done, you're not going to get anywhere else.
The Creighton faculty is something very special and very different. They facilitate your dreams and support you when you're down, and they lift you higher when you're up. So we really have something special here.
Student fit at Creighton University is someone who wants to be not just a practitioner.
Somebody who's passionate, is not afraid of change, not afraid to take risks, and who's compassionate and empathetic. I mean, that's the key, when you're dealing with people. Somebody that wants to change the world, really.
I always love the feeling of a presence of God, community, service in my life. I have known nothing different, and I wanted that, so it was very important to me when I chose a school.
I think it starts with the Jesuit values, the Jesuit values, the Ignatian values.
So you will hear a lot about Creighton values and Jesuit values and Ignatian values, but mostly what we're looking for is you to identify with your most important values and how do they all intermingle to be the best possible occupational therapist you can be.
For me, being someone who's very passionate about my faith, it was very cool to see how Creighton is able to integrate those values that you learn on your own into the field of study that you want to do. So that's the main thing about Creighton that stands out and means the most to me, is that they're able to incorporate those values into our practice.
Our entry-level OTD program is one program for pathways. And while the way you get down the path is a little different, the major outcomes that you meet along the way and the final outcome of being an OT with a doctorate degree from Creighton is the same.
There's multiple ways that you can be a part of the Creighton family through the OTD program, and not one is better than the other. We're all getting the same education.
We offer the very traditional clinical experiences, and we offer non-traditional clinical experiences to help build the whole person in terms of an occupational therapy practitioner. Across all of our disciplines, including occupational therapy, we offer some outstanding clinical experiences for our students.
It's very exciting that we can take our knowledge from the classroom and immediately apply it to help someone. There are Creighton teachers there to support us in case we don't know what to do or we're stuck, but it's an amazing opportunity to, one, help the community, two, practice our skills, practice our assessment skills, and practice documentation. I would never have this experience anywhere else.
That is definitely unique to Creighton, I feel, is the experiences that you get for your clinical rotations, because you have more of a variety, I feel, than other programs may have.
A large part of my wanting to be involved and being guided in the spirit of service came from Creighton.
I think those service opportunities allow students to learn things that are not easily learned in the classroom through a lecture or through reading a book, but they get you out in the real world where things are complex and there's lots of needs and challenges, but there's also lots of aha moments and real beautiful moments and opportunities for learning that can't quite be created in the classroom.
At Creighton, once you are admitted into our program, we are going to do everything we possibly can to make you successful.
I want to tell any future student that's thinking about coming to Creighton or it's just not decided, it's a wonderful place, and all they want to do is help you succeed in your life and be the best person you can be, not only in business, but in your heart and in your relationships and in your family.
We feel that our OT therapy are first rate. We know that our students perform well on every metric that we've offered them, including licensure exam rates, which are nearly 100% for our students. So that speaks to our program.
You know, if you really want to make a change in the world, Creighton's the place to go. You know, that's the place to come.
This program is teaching me not to find answers, because anyone can find answers. It's teaching me how to critically think and find the questions my patients need. And I think that's very unique to Creighton. I mean, everyone pushes to think critically, but the Creighton faculty here really look at things in every different angle they can.
If you apply to Creighton and you get that interview, as soon as it's over, you will want to be here.